When you first start seeing some concerns about your parent maybe not remembering as well, you don't always know exactly what to do and what does it mean. Today I'm joined by Dr. Alexandra Clark. She's a neuropsychologist at the University of Texas. Thanks so much for being with us and chatting with us today. When you start seeing these worries, what are the signs that we're looking for that there might be some dementia involved?
Oh, yeah. So early things that present oftentimes are people not remembering recent events, okay? So oftentimes there's like a preservation of remote things that have happened from their childhood, but recent things. So forgetting details of conversations that they've had, repeating themselves, not remembering if they completed a task already or not, those are certainly warning signs, okay? And then also word finding difficulties, can't quite find the word that they want to use in a sentence, sometimes mispronouncing words that they use all the time. Those are key factors.
I know in my case with my mom, one of the things I really noticed was processing, of noticing that the checkbook that she'd always been very meticulously about keeping, there was just some irregularities that I started noticing that I thought, something's not exactly right.
Okay, yeah, actually, cognitive impairment or cognitive change, subtle cognitive decline even, can cause changes in our instrumental activities of daily living. And these are really complex tasks like financial planning and management, figuring out how to put your pill box together, figuring out how to make medical appointments, things like that. Finances are oftentimes the most common one that pops up, that and driving, getting lost in familiar places, or passing your exit on the highway. Anything like that, you want to talk with someone and make sure that you're monitoring them over time. It's okay if there's an occasional lapse, okay? Those happen to us, and it's okay if you kind of occasionally forget where you need to be, right? But if this is happening consistently, more frequently, a couple of times throughout the week, that's a sign of a major problem.
Can you also be noticing too just how they're carrying themselves as far as is the house not as clean? Have they always been well dressed and now they're not like having the hygiene?
Yeah. So, forgetting to eat, not remembering to cook food, and not remembering recipes that they've commonly always made. That certainly is another indicator. And then, personality changes is a big one. So not just kind of what's happening in the house, but you're noticing that they're less interested in engaging in conversation, less interested in doing things that they love to do, and aren't deriving as much pleasure from being around people, and that was something that they always looked forward to, and being around other family members. Big sign that you want to look out for.
When you start seeing these signs, what do you do?
Yeah, so you need to schedule an appointment with a primary care physician. This is a doctor that you see on an annual basis, and you need to start logging any concerns that you have, things that you're noticing. You want to bring that to the primary care doctor, and they might refer you over to a neurologist or a neuropsychologist. We're all health professionals that work together, and we have different areas of expertise. A neurologist is really good at understanding, is this dementia? Is there some type of neurologic problem going on? Is it psychiatric? And they might do a brief cognitive screen when you come see them. And they'll also order some tests. We now have blood-based biomarker tests for Alzheimer's disease. These can kind of give us an indication of, is there something potentially to worry about? Is this a pathologic disease process? And then a neuropsychologist will do really comprehensive testing. There's some kind of changes that happen with aging that are normal, but there's a threshold to that, okay? They can get more severe, and the neuropsychologist helps distinguish between what is normal age-related cognitive change and what also might be problematic. And we really work in tandem with the primary care physician and the neurologist. We're all really trying to figure out, is this reversible? Are there things that are causing cognitive change that are things we can intervene on? Like maybe there's just low vitamin D levels. That's a really common thing that happens in older adults. They'll check your hormone levels as well. Those can also cause some cognitive changes. Check for mental health, depression, anxiety, also can impact cognition. And then we'll do that comprehensive assessment that consists of pen and paper task, computerized task, and is usually a couple hours long. It gives a really good snapshot of your cognitive abilities and thinking skills, and is a lot better than a screener that you might get in a primary care clinic.
So, but a lot of times you'll start with that basic screening in the primary care doctor's office.
Yeah, so sometimes you'll start with that, and then they'll say, hey, we're noticing just based on this screener, we might need a more comprehensive comprehensive assessment, or they might order an MRI and say, hey, we're noticing some volumetric changes in your brain. We think more comprehensive testing will help us figure out, are these brain changes correlating with any cognitive or behavioral changes?
How do you have that conversation with your parent that you really feel like it's important that we have these tests, and they may think that everything is fine and so they don't know why that would be necessary?
Oh, yeah.
Or they may not want to admit that they're having some concerns.
Yes, absolutely. I think there's a lot of hesitancy sometimes to go see a neuropsychologist or anyone with psych in the name. Absolutely.
Yeah.
And people are afraid of oftentimes getting a diagnosis of cognitive impairment. I always like to tell people, hey, think of this as like a mammogram. At 40, we recommend women go get a mammogram, and it's just as a check. At 65, we recommend that you go get comprehensive cognitive testing, and it's good for a check of how you're thinking, okay? It's a baseline cognitive testing. We always want a good baseline on you, because if there's any change moving forward, we can do a better job of detecting it. The other thing to tell them is early detection is key, because we can prevent it from getting worse. We have new therapeutics available to us that are disease-modifying agents that slow the progression of Alzheimer's disease. And a lot of the medications that we have that are even symptomatic treatments, those are really great early, okay? The earlier the intervention, the better. We can preserve your functioning, and it's also good to know, is there something going on, okay? If there's something going on, we can really, intervene earlier, and it'll be better.
Just more options for treatment, because at some point, if you wait too long, there's really not much you can do, right?
It's hard, and the treatments are much less effective when you get to the kind of more moderate to severe stage of dementia. We want you to preserve your independence and functioning for as long as possible, to have good, high-quality years of life, and that usually it corresponds to you having as intact cognition and as much preservation of your cognitive functions as possible. So I always like to tell people, hey, everyone at the age of 65 should get this. Medicare covers this, and a lot of health insurance cover this for a reason. It's a good, preliminary test.
Yeah.
And if you're noticing things change over time, it helps us detect things earlier so that we can figure out, all right, maybe now's time to start an intervention. Also, just going to a neuropsychologist doesn't necessarily mean that they're going to find cognitive impairment, okay?
Right.
Oftentimes they're going to say you're doing great. And I always think it's nice to know if you're doing great as well, right? We want to know, okay, I've got nothing to worry about.
Right.
I'm doing what I need to be doing, and I'm just going to keep doing that. And that's good as well, right?
It can be a reassurance.
Absolutely.
Right. I also think that we hear a lot from people who have parents with dementia that then they're seeing their decline, that the biggest fear is, okay, what do? I don't want to be in that situation too. So what can we do, especially if we're watching a parent with a loved one with dementia, and we think, what can I do to make sure or hope better my odds that I'm not going to get it?
Yeah, so we've actually learned that there's up to 45% of dementia risk can actually be modifiable or prevented. And that's things really like taking care of your vascular health. We want to prevent the development of diabetes, hypertension, high cholesterol. Detecting those things and treating them immediately are really important. And these are things that just kind of happen with age, right? In midlife, a lot of these vascular health conditions present. And if we can get on top of them and keep them from getting worse over time, then, we can prevent dementia risk or reduce your risk for dementia. Other things to think about are physical activity. You got to stay active, all right? Physically, we want you to be active aerobically, moving your heart, and as well as strength training, okay? As well as stretching. It's a whole body thing. We realize aerobics isn't just, the only important thing. Strength training is key, okay? Reading, staying mentally engaged, very important. You don't have to go learn a new language, although that does keep you mentally challenged. But reading is really important. It keeps you've got to follow plot lines, you've got to link characters together, and then talking about what you're reading with other people inherently contributes to socializing, which is another big thing. Okay, staying socially active and connected to people, not being isolated is really important. And then finally, your mental health. stress and like we're living through a really difficult time, we want to make sure that you're not depressed. We consider that to be a modifiable risk factor for dementia, as well as, chronic stress, anxiety, and like you're feeling tense, highly irritable. If you're feeling those symptoms, oftentimes we can offer medication, and there's also therapy that is highly effective. And again, these are modifiable factors, and meaning that we can do something about them, and you should be looking out for them and intervening on them early.
Yeah. What are the risk factors that we can't control?
Yeah. So age is a big one. Okay. As we get older, you're at increased risk for dementia. It doesn't mean that as you get older, you're guaranteed to develop dementia, but there is a risk associated with aging. Another one is genetics. We have some genetic variants, deterministic and risk genes. So those genes are like PSN1, PSN2, APP, and ApoE4. That's one that you can get when you do that 23andMe testing. The deterministic genes basically say if you've got these genes, you're destined to develop dementia. But the risk genes, which are actually way more common, if you kind of note that you've got one of these, you're at increased risk, but again, not guaranteed to develop dementia, okay? And then finally, family history. If you've got a strong family history of dementia, multiple family members have been impacted, your grandparents, your sibling, your parents, that is even more of a reason to get some baseline testing at the age of 65, so that if we know you're at risk, if we detect any type of cognitive change, again, we can intervene earlier.
But I think the key to that is just knowing that the more you know, the more you can try to do to help prevent or prolong.
Absolutely. Information is key, and I don't want people to be scared of it. Sometimes they're, afraid to go to the doctor because they don't want to hear bad news. But information is power, okay? We know that if there's something going on and we can detect it, we can immediately get ahead of it as opposed to dealing with it after the fact. Treatments are helpful, but they're not as effective as prevention, okay? So if we know there's some mild changes, that we can prevent that from getting worse over time. We don't want to just be treating once you've already developed the disease.
Right. So that's why this all needs to start early. The earlier, the better.
Early intervention, diagnosis, identification, those are always things that are coming up in our conversations with people and a part of any psychoeducational material we're giving people. And that's a reason not to be afraid to go to the doctor, not be afraid to have these conversations with the doctor, and to make notes and just keep track of things with your loved one, as well as if you're noticing things, write them down, start those conversations early.
And I'm thinking what I'm hearing you say too is start those conversations with our parents, as well as the things that we're telling ourselves as far as watching, getting the treatment, or just watching, getting those tests done.
Yes, right. Yes. Get the test done. Start the conversations with your parents about what are their wishes. Are they noticing any changes? And then you want to have those conversations with your kids too, moving forward, right? Oh, if I'm starting to experience cognitive decline or cognitive changes, I want you to have a conversation with me about it so that I know that I need to go to the doctor and get it checked out.
Yeah. I have a friend that actually wrote herself a letter and gave it to one of her daughters and said, if I start having memory problems, please show this to me that I've given you permission to
have
do
this
these things.
conversation.
Yeah, exactly. And what do you do with a parent who doesn't realize they have a problem? Literally doesn't think that like just the other day, my mom said, do you think I have a memory problem? I don't think I have a memory problem.
Yeah, that's actually can be a part of the disease. It's called anosognosia, which is a lack of insight or awareness into your cognitive problems. The biggest place to start with them is say, I think we need to go to the doctor, and to leverage the conversations and medical appointments with the doctor to help give them additional insight. Okay. I would also say this is where writing things down are really helpful. You don't want to attack them or really make them feel uncomfortable, but sometimes when you point out to them, you got lost and I was worried, okay? Or I'm a little worried about you watching our grandkid alone. That can kind of be more salient to them and activate those emotions, and also motivate them to go to the doctor and get a more thorough evaluation.
Okay. Because I think that we've gotten to the point where that having those conversations don't help because she doesn't remember.
Yeah.
And so that's the part where I always say that dementia just doesn't make sense. It just is, it just doesn't make sense.
No.
I can't think of a better way to describe it.
Yeah. It's hard. I think kind of knowing that, like this is a key feature of it is they don't remember, and they're especially not going to remember these conversations.
Right.
It's you got to know it, and it's helpful.
Right.
And we can't kind of get in a battle with them about things because it can make them feel really defensive and isolated. But yeah, it's really incredibly difficult as a caregiver to navigate, right? When they don't have the insight, and they're asking the same questions over and over again. There's some really great tools or tips that the Alzheimer's Association offers about how to talk with loved ones about these issues that they're experiencing. You can go to the alts.org and look at patient resources, and it'll give you some prompts and to ask people. And there's a workbook even that you can fill out. And then these are fantastic resources. You want to start doing them earlier, and they'll teach you skills also to leverage when you're at that moderate to severe part of the disease process as well.
We've learned about therapeutic fibbing and all of those different kinds of techniques.
Confabulation,
Confabulation, awesome.
Yeah.
Well, thank you so much for sharing your expertise with us today. It is a topic that we could go on for a long time. But you've given us a lot of great information to take today. So if you have any other ideas that you'd like us to cover in Parenting Aging Parents, please let us know.